Hey, this is Dylan Hoffman, first year student in the Indiana State DAT program. Uh, Today, this talk is me kind of going over my thoughts about risk factors of the lower extremity and some of the literature that we've looked at this week in that. What really surprised me wasn't so much the quantity of research. I had known there's a lot of research out there on the lower extremity, especially looking at both interventions and risk factors. But what surprised me, I think, was the lack of consensus out there, and the amount of research that looked at a specific risk factor, but didn't really look at how they all really come together, and really give us a picture of how susceptible an athlete is to a lower extremity injury. A model that was mentioned in the literature that I found really interesting was and I'm going to butcher this name, so correct me in the comments, but the Menuise model, and the way that it kind of looks at what are the intrinsic risk factors, what are the extrinsic risk factors that take a predisposed athlete to a susceptible athlete, and then you have your MOI. I've always and even when I document, I've only looked at what's the MOI. An inversion force on the ankle causes a lateral ankle sprain, and I've never really looked at how many factors and how do all the factors come together. So that's something I want to start doing in my practice more, is looking at how can I catch some of these factors, especially the extrinsic factors that are modifiable. How can I start to catch those and start to kind of pull those away and eliminate those from my patient population as a whole, and bring down the number of occurrence of lower extremity injuries? So that's something that I really look forward to doing. And maybe that's even educating coaches in ways as I dive through the research and go into the research more of what are some ways that we can look and see what factors are my athletes having and what can I kind of take away from that. And then lastly, something I want to start doing, today, is looking and seeing what risk factors, what extrinsic risk factors do my patients currently have, or are my patients currently going through. And I know in the research that in the literature it mentioned you really need to see 20 to 50 cases to start to find a correlation, find that risk factor. And that's not something I can start doing today. But what I can do is start looking back at some of my cases and seeing what are they having familiar, what are they having that's going with everybody else, especially when I get these kind of strings of injuries, like I've actually recently had, where I'm having a string of lower extremity injuries all at the same time. And what is the common risk factors that are external that I can perhaps modify? And so that's just a real quick recap of what I've seen in the lower extremity literature. I'm excited to dive deeper into that and discuss with my peers of ways that I can have a bigger influence on those risk factors. But it's really been interesting to see how I could look at risk factors of low extremity through a different light.